the shoulder joint, ladies and gentlemen. I am consulted with by many patients on numerous occasions for shoulder pain. My previous video that you might have seen was around causes of shoulder pain. Today I'm going to actually go through the anatomy of the shoulder blade itself, the upper arm, i.e. the humerus, which refers to this region here, and how the two articulate, as well as going on showing you precisely where the tendon of the biceps muscle goes, the long head, as well as the supraspinatus tendon, the main muscle from the rotator cuff that is often injured and I see a lot of issues with. So without further ado, here we have the shoulder blade. Okay, this here, so first and foremost, this is you looking directly at me. This is the left shoulder blade, and this would sit kind of at the back over here. So this area you would not see, the rib cage would sit in front over here, and that gap between the rib cage and the actual blade itself here is where we find one of the rotator cuff muscles, the subscapularis to be precise. Then when we look at it, so if I turn this around so that you are now looking at me from the back, this is my left. This region here is the spine of the scapula, and here is where we find the infraspinatus muscle, and here it is where we find the supraspinatus muscle. Again, the other two muscles from the four muscles that form the rotator cuff. The last is the teres minor, which I won't be going on to today. Now, how is this important? It's important because when you look at this, so if I now turn this around side on, so you're now looking at me like so from the side, this here, and I'll bring this closer, this little here, a region is what we call the glenoid cavity. It's a little shallow depression, okay? And you've heard of the shoulder joint, probably being known as a ball and socket joint. This is a socket. This shallow impression is further deepened by a ring, a rubber ring, you know, like we do in plumbing. We get the rubber rings to enhance the seal or otherwise to deepen the actual articulation. That rubber ring sits over here called the labrum, and precisely as we just said, what it does is deepen that socket. The humerus, which is the upper arm, really interesting structure. Again, this is the left humerus. This is you looking directly straight. The elbow, in fact, this is the ulna, and if you notice, this little region here sits in and it forms this kind of articulation. Okay, so that's the olecranon process, and this inserts in at the back like so, and that's your elbow joint. Now, keeping to the humerus, looking at this from the front, this groove over here, you might be, I'll bring it closer, so this groove over here is the intertubercular groove, given that this is the greater tubercle and that is the lesser tubercle. The biceps tendon has two heads. The long head of the biceps tendon, the muscle that sits here, the actual tendon runs through that groove. Now, if you were to feel on yourself over here, you can actually feel that tendon. It runs just under your fingers like a ropey sensation. That's your biceps tendon. This articulates with this like so. Okay, like so. So move it back, and that's where you get that articulation. Now, moving on, what we've got is this region here called the Coracoid Process, and here we have the acromion. This fella here articulates with the clavicle. Okay, the clavicle. Now the thing is, this is the wrong clavicle, so I can't use this to demonstrate, but just purely for demonstration purposes, that's kind of what happens over here. Okay, except like I say, it's the wrong one, so I'm not going to use that. So the clavicle sits on top, and what we have in my situation here, for example, this is what would be, and we would get this. As I said, this is the wrong clavicle, so I'm not going to use it, but that's precisely what would happen. So these two here would form the AC joint. The AC joint is very important, the acromioclavicular joint. And a lot of injuries I see are actually associated with the AC joint, more so than this ball and socket joint that I call, and that's what we call the Glenohumeral Joint, because that's the glenoid cavity, and that's the humerus, the head of the humerus, and that's the Glenohumeral Joint. The true joint itself, this has a capsule around it, the GH capsule, the Glenohumeral Joint capsule. Now, going back to the shoulder blade, the other important thing I wanted to bring forward now is once you get this articulation, the long head of the biceps runs through that bicipital groove and attaches all the way onto here. So in and around the coracoid process, but also around this region here. Okay, the coracoid process is an important point as well, because you've got some of the muscles that attach onto there, including the pec tendons, and an area just literally in here that can be otherwise tender. The other important structure I want to go back to, so now if I turn so that we're doing this, so you're looking at me from the top, I mentioned a moment ago the supraspinatus muscle. So overlying the supraspinatus muscle, like so, is the trapezius, the upper traps, but supraspinatus, and it runs, tendon to that, runs under this bony arch here. So this arch is what we call the acromial arch. So underneath that arch is the subacromial arch, and that tendon runs under this arch and attaches onto the greater tuberous, tubercle, and that essentially, because it attaches in that region, allows this motion here. Now, when you get inflammation of that tendon, when I bring my arm out like so, notice, so if I show that, notice this gap, I'll do it again, it becomes smaller, okay? And if that tendon is inflamed, then as we do this motion, then of course we're going to get pain in certain areas. The other thing what we've got here is overlying that tendon, or on top of that tendon, and again underneath that arch, so again subacromial arch, we've got the subacromial bursa. And again, a bursa is a fluid-filled sac, it's like a cushion, and what it does is it prevents excessive friction between the tendon and the bone for the most part of it. Now in this given situation, again, if we get inflammation of that as we do this motion, that too can be painful. I hope that was useful. That's basically, excuse me, that's basically everything I wanted to go through. The scapula itself, this is the body of the scapula, and before I leave, notice how thin that actually is. So if you can see my finger at the back over here. So very, very thin structure really. Very difficult to fracture, an extremely rare occurrence for this to fracture, and were this to be fractured, then you do want to consider that the patient has gone through some serious trauma. And the last thing I wanted to mention with the humerus, quite important, is you've got the radial nerve. The radial nerve runs from the back out through the quadrangular space, passing the triceps around the shaft of the humerus itself, and then goes in and innervates the muscles that actually cause extension of the forearm. So that kind of action, and you can see those extensors kicking in. And the reason that's important is because if we get a fracture of the shaft of the humerus, then what we've got is the risk of causing paralysis of the radial nerve, what we call radial nerve palsy. That usually would require surgical intervention, and we want to try and salvage that as best as possible. I hope you enjoyed the video. Thank you for watching.